With the most recent study coming out, it actually implies up to 50% or more of acute heart attacks are triggered by oral infection. That's huge. Heart attacks are the #1 killer in this country. Strokes are the #1 cause of disability, and it's all preventable.
Inflammation sets up a reaction that causes things in our body that makes us less responsive to insulin, which is how we develop type 2 diabetes. So whether it is inflammation from just a fat belly, or whether it's inflammation from gum disease, or whether it's inflammation because you've got a chronic abscess someplace, it causes the same process of a resistance to insulin, which leads to type 2 diabetes, or is the hallmark of type 2 diabetes.
Even mild periodontal infections, when it occurs in combination with some other secondary infection, could cause severe adverse outcomes. And for periodontal disease, it tends to be ignored because it doesn't kill. But I think what we're showing here is periodontal disease does kill, because if the bacteria gets into the blood circulation and gets to the uterus, it could kill the baby.
I want you to think about this. Inflammation, and there's a concept called inflammatory burden. When you get more inflammation in your system, the accumulation of that will have a tipping point where you tend to have inflammatory disease. Inflammatory diseases are heart attacks, strokes, diabetes, rheumatoid arthritis, various cancers, kidney disease, pancreatic cancer. The list goes on and on and on.
We're in a state of chronic inflammation, and that's the basis for every disease that everyone has. It's the basis for cardiovascular disease. It's the basis for cancer. When you're dealing with periodontal disease, there's this entire inflammatory cascade going on that people don't understand. When you get a cut, for example, okay, your body is set up to heal that cut, and that goes through a process of inflammatory response to solve the problem and resolve. If you always have a chronic inflammatory bacterial condition in your mouth, then you never turn off that process of inflammation. In other words, it never gets the opportunity to resolve and go away. There's just too much. The body can't react to all of them, and the body gets sick.
One of the keys in everyone getting healthy is decreasing inflammation. And the most powerful thing we know about decreasing inflammation is taking care of your gums. And dentistry has a key role in that.